This program is brought to you by Community Reach Manchester in association with NHS North Manchester Clinical Commissioning Group. बिस्मिल्लाहिर्रहमानिर्रहीम। अस्सलाम वालेकुम नाज़रीन। प्रोग्राम हेल्थ आवर के साथ समीना खान आपकी खिदमत में हाज़िर। इस प्रोग्राम में आपको पता है कि हम बात करते हैं मुख्तलिफ हेल्थ इश्यूज़ के हवाले से, और इसमें हमारे मुख्तलिफ एक्सपर्ट गेस्ट होते हैं जो कि हेल्थ के हवाले से हेल्थ प्रोफेशनल्स होते हैं, डॉक्टर्स होते हैं, कंसल्टेंट्स होते हैं। हमें मुख्तलिफ हेल्थ इश्यूज़ पे बात करते हैं हम, और आप लोगों की कॉल्स भी हम लेते हैं प्रोग्राम में। बेसिक मकसद ये है कि आप लोगों को बेसिकली आगाही देना, इन्फॉर्मेशन देना आपकी हेल्थ के हवाले से, आपकी सेहत के हवाले से, कि कैसे हम अपने आप को अपनी सेहत को बेहतर बना सकते हैं, मुख्तलिफ बीमारियों से बच सकते हैं, और ख़ास तौर पर सबसे इम्पॉर्टेंट बात कि A&E यानी कि एक्सीडेंट और इमरजेंसी का इस्तेमाल किस तरह से हम कम कर सकते हैं, ताकि वहाँ पर जो प्रेशर है उसको कम किया जाए। और बाज़-औक़ात हमारा बहुत सा वक्त ज़ाया होता है वहाँ जाकर, हम जब बैठते हैं इंतज़ार करते हैं, अपने उस वक्त को कैसे बचाया जा सके। और ये जो प्रोग्राम है इसको एक वॉलंटरी ऑर्गेनाइजेशन है कम्युनिटी रीच मैनचेस्टर, जो कि प्रेजेंट करती है इन एसोसिएशन विद NHS नॉर्थ मैनचेस्टर क्लिनिकल कमिश्निंग ग्रुप। आज के इस प्रोग्राम में हम बात करेंगे फ़र्स्ट एड के हवाले से। आमतौर पर स्कूल्स में मुख्तलिफ जो हमारे इंस्टीट्यूशंस हैं, बिज़नेस फैकल्टीज़ आप कह लें, वहाँ पर भी मुख्तलिफ कंपनीज़ के अंदर भी फ़र्स्ट एड के हवाले से लोगों को बेसिकली एक तरह से इन्फॉर्म किया जाता है, बताया जाता है कि अगर खुदा न खास्ता कहीं किसी वक्त कोई ऐसी सिचुएशन आ जाए कि आपको फ़ौरन बेसिक फ़र्स्ट एड देनी पड़े, तो आपको क्या करना चाहिए। और इस हवाले से आप देखते होंगे कि हर ऑफिस में एक बेसिक फ़र्स्ट एड किट जो है वो ज़रूर मौजूद होती है, और इसकी वजह यही है कि बेसिक जो फ़र्स्ट एड है उसके बारे में आपको पता चले, और जो लाइफ सपोर्ट है, और ख़ास तौर पर जो मेडिकल इमरजेंसीज़ होती हैं, जैसे कि अगर किसी को खुदा न खास्ता स्ट्रोक हो गया है या हार्ट अटैक हो गया है, तो उसमें आपको सबसे पहले क्या करना है, बेसिक फ़र्स्ट एड कैसे देनी है उस पेशेंट को, इस पे आज हम अपने प्रोग्राम में बात करेंगे। और सबसे पहले मैं इंट्रोड्यूस कराऊंगी अपने आज के प्रोग्राम के गेस्ट को। जो दोनों मेहमान हैं मेरे आज के प्रोग्राम के, वो एक्सपर्ट्स हैं, और नॉर्थ वेस्ट एम्बुलेंस सर्विस जो कि NHS ट्रस्ट है वहाँ उसके साथ काम करते हैं, एसोसिएटेड हैं। सो आई विल इंट्रोड्यूस माय फर्स्ट गेस्ट जुल्फ़िकार अली। Thank you very much, Zulfiqar, for joining me in the program.
Assalamu alaikum. Thank you very much for inviting both of us. It's very kind of you. Yeah, we're here today to try and help in any way we can. मैं उर्दू भी बोल सकता हूँ थोड़ी सा।
हाँ, बल्कि ये तो ज़रा अच्छा होगा कि आप उर्दू में भी जब बात करेंगे तो हमारे लोग हैं
इंशाल्लाह मैं कोशिश करूँगा।
Definitely. And the second guest tonight is Sara Harris. Sara, thank you very much and welcome to DM Digital.
You're very welcome. I'm very pleased to be here tonight.
Thank you very much. Right, Zulfiqar, बेसिक फर्स्ट एड के हवाले से लोगों को इन्फॉर्मेशन तो मिलती है, लेकिन आप लोग एंजल्स हैं, यू गाइस आर एंजल बिकॉज यू आर देयर व्हेन वी नीड यू डेस्परेटली। सो सबसे पहले हम बात करेंगे कि जो व्हाट इज़ द रोल ऑफ पैरामेडिक्स, पैरामेडिक्स का रोल क्या है, और इसमें कैसे आप असिस्ट करते हैं लोगों को।
हाँ, बात यह है कि पैरामेडिक्स का जो रोल जो है ना, बहुत कॉम्प्लिकेटेड रोल है, लेकिन वो सिंपल भी रोल है। कॉम्प्लिकेटेड है, हम बहुत सारे काम करते हैं, लेकिन सिंपल भी है, हम देखभाल करते हैं, मरीज़ की देखभाल करते हैं।
थोड़ा सा ऊंचा बोलिएगा जुल्फ़िकार।
हम देखभाल, मरीज़ की देखभाल हम करते हैं। जब कोई 999 टेलीफोन करता है तो फिर ज़्यादा तौर से वो पेन में होते हैं, या उनको कोई दर्द होता है, उनको या
ज़रूरत होती है आपकी।
हाँ, हमारी उनको ज़रूरत होती है। हम जाते हैं, माय कॉलीग सारा और मैं भी हम जाते हैं, उनको जो ज़्यादा दर्द हो तो हम दर्द के लिए हमारे पास दवाइयाँ होती हैं जो हम देते हैं। अगर वो बीमार ज़्यादा हो तो हम उनको अस्पताल ले जाते हैं अस्पताल। ऐसे हमारे काम, हम बहुत सारे काम करते हैं। हमारे जो टेलीफोन यूज़र सर्विस यूज़र जो होते हैं ना, कहीं यूज़र सर्विस वो बड़े उम्र वाले होते हैं, 100
एल्डरली होते हैं, बुजुर्ग होते हैं जो, हाँ जी,
और नौजवान भी होते हैं, और वो बच्चे भी होते हैं, न्यू बॉर्न्स भी होते हैं। हम बहुत सारे जो हमारे मरीज़ जो होते हैं ना, वो सब डिफरेंट उम्र के एज ग्रुप, डिफरेंट एज ग्रुप भी होते हैं। वो बीमारियाँ भी, बहुत सारी डिफरेंट बीमारियाँ होती हैं उनके पास। हम और बीमारी के सिवा हम वो जो एक्सीडेंट्स जो होते हैं या जो ट्रॉमा जो होता है ना, हम ट्रॉमा के लिए भी हम हम काम करते हैं, ट्रॉमा का भी काम हम करते हैं.
So something to do with the mental.
हाँ बिल्कुल बिल्कुल. हम बहुत सारे जो हमारे मरीज जो होते हैं ना, उनकी मेंटल हेल्थ के लिए हम बहुत सारा काम भी करते हैं. हमारे जो मरीज़ होते हैं वो सिर्फ फिज़िकल एलिमेंट्स नहीं उनको होती, उनको मेंटल हेल्थ भी उनके कई बार उनका मेंटल हेल्थ के लिए हम भी उसकी भी देखभाल हम करते हैं.
Right. Sarah, my next question is very important. What should we do when someone is choking? And I mean, obviously, I mean, if I'm there, for example, I don't think so I will be able to cope with it. But I want to know if someone's choking, what should we do? And I think if you have to do a little bit of, if you can do a little bit of a presentation for the viewers,
yeah,
please.
I'll use the doll for
yeah,
this.
Yeah, please, yeah.
It's really important that you act quickly.
Yeah.
So I'm going to use the resusciani. Okay, so the first thing you would do is you would ask the patient to cough. Okay, it's important that you would stay calm. So you'd lean the patient forward and get them to cough. Okay, if they can't cough, we would then give them 5 back slaps in between the shoulder blades, leaning them forward. It's important you tell them what they're going to do because they're choking and then you're going to hit them, okay? So we do this up to 5 times. So
the body position should be like this,
yes,
slightly
angle, leaning over so that
right,
if that object that's choking them
yeah,
comes out, if they're leaning forward, it can come out.
Right, okay.
Okay, so we do this 5 times.
5 times.
1, 2, 3, 4, 5. Okay, now hopefully within those 5 back slaps, whatever it is has come out.
Okay.
Now if it doesn't, we would do what are called abdominal thrusts.
Okay.
So I'm going to use you now to demonstrate this.
All right, would you like me to stand up?
Yes, please.
Okay.
Okay,
I'm a bit
so
mic'd up, yes, just
sorry.
All right.
So we would come behind like this, lean them forward, okay, and we get a fist in between where the belly button is and the ribs. Put this in and we pull it in and up
right,
to 5 times.
Right. Okay.
And what you're trying to do is increase the pressure in the abdominal cavity so that the foreign body comes out.
Right, okay.
Okay, and it's quite serious to have to do this. If you have to do this on anyone, you need to go to hospital.
Okay.
But if you don't get that foreign body out, they will stop breathing.
Yeah, obviously.
Okay,
Is
so
that right?
yes, thank you. So
Wish I
when
had
you've
some
done
abs
5
now.
of those, you'd pick this back up
Okay.
and you do 5. Okay.
Again.
Okay, and you keep doing this cycle of 5 back slaps
And 5.
and then 5 abdominal thrusts.
Okay.
Eventually, the person, if you don't release the foreign object, will go unconscious. And later in the programme, we're going to show you how to deal with
Unconscious person.
and CPR.
All right, okay. Thank you very much, Sara, for this demonstration.
Okay.
And I think it is really difficult to deal with the children when, for
Yes.
example, then when they choked, and because small little objects like Lego or the part of any toy, they can, it could be disastrous.
Totally, and if it's a child between the sort of age of 1 to puberty, you'd do exactly the same, but you would come down to the child's height, and you'd still do the back slaps, and you'd still do the abdominal thrust. But if it's a baby under 12 months old, we would do the back slaps over there.
All right,
Okay, so we would lay the baby on your leg, give it 5 back slaps, but then we turn the baby over, and using 2 fingers, we would give what are called abdominal thrusts, and we would press 5 times hard into the chest to hopefully get out that foreign object. When you've done 5 of those presses, you would turn your baby over again and keep slapping. And obviously you would call 999. But the sooner somebody does something when someone is choking, the more likely it is to work, because as the person panics,
especially this is to do with the breathing, and if he stops breathing, then obviously he's gone, finished.
And they will get worse very quickly without your actions.
Yeah, बहुत important है कि अगर कोई भी कोई चीज़ stuck हो गले में, yeah, तो ज़ोर से पीछे को ऐसे slap करो, पीछे को 5 बार, और फिर देखो कि अगर वो जो चीज़ stuck थी वो निकल आई है या नहीं. اور ٹیلیفون بھی 999 ٹیلیفون کرنا بھی امپورٹنٹ ہے.
امپورٹنٹ اٹس ریئلی امپورٹنٹ. لیکن 999 پہ فون کرنے کے بعد بائی دا ٹائم دا ایمبولینس از دیئر یو ڈونٹ نو. I think it normally takes 9 minutes. An ambulance takes 9 minutes to come to your place.
It depends where the ambulance is at
Exactly.
that point.
But minimum time scale is 9 minutes that they come there.
The government targets 8 minutes to get to an emergency.
We try to get there. ہم کوشش کرتے ہیں کہ ہم فوراً پہنچنے کے لیے ہم کوشش کرتے ہیں, لیکن sometimes 5-10 minutes لگ جاتے ہیں.
Right. And how? Okay, that's fine. We have done, and you have shown the demonstration how to deal with the patient if he's choking. How to deal with the minor burns? I mean, how can we deal with the minor burns?
اگر minor burns جو for example ہاتھ پہ ہو, اگر کوئی کوکنگ کر رہا ہے اور یہ گرم پانی لگ جائے ہاتھ پہ,
اسٹیم اسپیشلی اسٹیم کا ہوتا ہے.
اسٹیم تو ہوتا ہے بالکل. اگر مائنر برنس ہو تو پہلی چیز تو یہ ہے کہ فوراً اس کو ٹھنڈے پانی کے نیچے رکھ دو.
اچھا, فوراً ٹھنڈے پانی
ٹھنڈے پانی کے نیچے 10 منٹ کے لیے ہے. لیکن یہ ایک بات ضروری ہے کہ وہ جو ٹھنڈا پانی ہو آئس والا پانی نہیں ہونا چاہیے.
نارمل ٹیپ واٹر.
ٹیپ واٹر 10 منٹس کے لیے ٹیپ جو کھول کے نا ٹھنڈا پانی اس کے اوپر. اور کیونکہ لوگ بھی کہتے ہیں کہ اس کے اوپر یا گھی یا کوئی بٹر لگاؤ, یہ بالکل رانگ ہے.
ٹوتھ پیسٹ, نارملی they use toothpaste on the burns.
It's important not to use any fat or anything like that. بہت امپورٹنٹ ہے کہ وہ گھی یا بٹر بالکل نہیں استعمال کرنا. صرف اس کو پہلے 10 منٹ کے لیے ٹھنڈے پانی کے نیچے رکھ دو. 10 منٹ کے بعد اگر کچھ چھاپ ہو یا اور کوئی بریسلٹ ہو اس کو نکال دو. اور اس کے بعد کلنگ فلم جو آتی ہے نا, آپ کلنگ فلم, ہاں جسٹ یوز کلنگ فلم. تو یہ جو جگہ ہے نا اس کو پوری جگہ کو کلنگ فلم سے اوپر رکھ دو اس کو. کلنگ فلم 2 کام کرتی ہے. ایک تو وہ صاف ہوتی ہے, بالکل بیکٹیریا فری ہوتی ہے کلنگ فلم, اور وہ جو برن جو ہے نا اس پہ بیکٹیریا نہیں لگے گا. اور دوسری بات یہ ہے کہ وہ جو کلنگ فلم جو ہے نا وہ اسکن پہ نہیں وہ اسٹک ہوتی. وہ کلنگ فلم جب وہ ہسپتال جائیں گے نا, اگر ہسپتال جانا ہو تو جب وہ نکالیں گے کلنگ فلم کو, وہ کلین نکل آئے گی. وہ کلنگ فلم وہ اسٹک نہیں ہوتی, اسکن پہ نہیں اسٹک ہوتی. اس لیے ہم کہتے ہیں کہ اگر کلنگ فلم ہو نا وہ استعمال کرو. اگر کلنگ فلم نہ ہو تو کوئی صاف کیریئر بیگ جو ہے نا اس کو ہاتھ میں کیریئر بیگ میں ڈال کے اس کو بند دو. اور پھر اگر زیادہ درد ہو تو آپ پیراسیٹامول لے سکتے ہیں یا آئبوپروفن لے سکتے ہیں. لیکن اگر پورا ہاتھ پہ ہو نا, پورا ہاتھ اگر سڑا ہوا ہو تو پھر ہسپتال جانے کی ضرورت ہے. اگر تھوڑا سا برن ہو 1 انگلی پہ یا 1, 2 یا 3 انگلی پہ, صرف انگلی پہ ہونا, پھر ہسپتال جانے کی کوئی ضرورت نہیں. آپ پھر اس پہ 10 منٹ کے لیے ٹھنڈا پانی لگاؤ پہلے, اور پھر اس کے کلنگ فلم لگاؤ. اور پھر اگر زیادہ درد ہو تو پیراسیٹامول یا آئبوپروفن آپ لے سکتے ہیں. اس کو ہسپتال جانے کے لیے ضرورت نہیں. لیکن ایک اور ضروری بات ہے, اگر اس پہ وہ جو بلسٹرز جو آتے ہیں نا, اردو میں پتہ نہیں بلسٹر کو کیا کہتے ہیں, لیکن انگریزی میں بلسٹرز, اگر بلسٹرز ہو نا ان کو, کیونکہ لوگ کہتے ہیں کہ ان کو برسٹ کرنا, ان کو پاپ کرنا, لیکن پاپ نہیں اس کو کرنا, ان کو رہنے دو. جیسے ہے نا وہ اسکن آپ پروٹیکٹ کر رہی ہے, اس کے نیچے جو برن ہے نا وہ اسکن پروٹیکٹ کر رہی ہے بلسٹر کر کے. اس لیے وہ امپورٹنٹ بات یہ ہے کہ بلسٹر جو ہے نا وہ خوبصورت نہیں لگتے, ان کو پتہ ہے وہ خوبصورت نہیں لگتے, لیکن وہ ضروری ہے. اسکن
وہ پروٹیکٹ کر رہے ہیں آپ کو برن کو جو نیچے ہے, اور دوبارہ سے اسکن جب تک آتی ہے تو وہ اس کو پروٹیکٹ کرتے ہیں. اچھا, یہ تو ہو گیا کہ آپ کے ہاتھ کی آپ نے بات کی. فار ایگزامپل سم ٹائمز جو ہے کوئی بچہ ہے یا بڑا ہے جس نے وولن سویٹرز پہنے ہوئے ہیں اور اس کے بازو پہ لگ گیا ہے, اور وہ آپ کو پتہ اون کے سویٹر ہیں, کیا کریں؟ وہ فوراً اتار دیں سویٹرز کو, کیونکہ اگر سویٹر اتاریں گے تو اسکن ساتھ میں اترے گی.
ہاں, لیکن جو وہ اتار سکتے ہیں نا تو اتار دو. لیکن وہ نہیں, وہ جو کپڑے جو وہ نہیں وہ لگا سکتے, اور پھر ان کو رہنے دو, وہ ہسپتال ان کو نکال دیں گے. لیکن بات سیم بات یہ ہے
کہ اس کو بھی فوراً ٹھنڈے پانی,
اگر یہ بازو ہو تو اس کو ٹھنڈے پانی سے 10 منٹ کے لیے ٹھنڈے پانی کے نیچے وہ رکھ دو. لیکن اگر وہ زیادہ ہو نا, ہم کو پتہ لگ جاتا ہے نا کہ اگر برن زیادہ ڈیپ ہے تو زیادہ درد ہے, تو فوراً ایمبولینس کو بلا لو. ایمبولینس پہ ہمارے پاس ایک اسپیشل ڈریسنگز ہوتے ہیں, تو ان میں اینٹی بیکٹیریل کریم لگی ہوئی ہوتی ہے, وہ کولنگ کے لیے ہم استعمال کرتے ہیں. وہ بہت بڑے ہوتے ہیں, وہ ہم لگاتے ہیں اور برنز پہ, اور انشاءاللہ پھر ہم جلدی ان کو ہسپتال پہنچ جاتے ہیں.
Right. Sara, Normally, I think everybody tries to have to keep a first aid kit in their homes or in offices. What should I have in my first aid kit?
If it's at the home, you can buy most first aid kits, say, at the supermarket, and there is a British standard for it. If it's in the business, depending on how big your business is, will depend on what you need in your first aid kit, and they will tell you that. But typical things you should have in there is an emergency response leaflet, so what to do in an emergency, some gloves to protect them if there's any blood, dressings, plasters, triangular bandages, safety pins, eye patches. That's the basic scissors of a first aid kit. And then the larger your organisation goes, the more you would need of all the different things.
So would you recommend keeping some paracetamol in there, just in case?
It's not part of the guidelines,
right.
but if
So
at home you could do
indeed.
that, yes.
Indeed.
Yeah.
One of the issues is एक इम्पोर्टेंट बात यह है कि वो जो डिब्बे जो फर्स्ट एड किट्स जो होते हैं ना उनमें अगर दवाइयाँ हो तो चेक करना पड़ता है कि दवाई की आउट डेट नहीं तो I would just say
That's
it's
really
important.
Expiry date.
Yeah, expiry
Yes, very
नहीं हो.
important to check the expiry date. Yeah.
And replace things when you've used them, especially in the workplace. They get used and then everybody forgets to fill the first aid kit up again, and then the next time there's an emergency, there's no kit there.
That's right, that's right. Okay, but do you think that normally we keep first aid kits at our homes? Is that a normal practice by people? Have you noticed anything?
I would say a lot of people don't have
Don't
first
have
aid.
first aid
Yes,
kits.
and I would recommend that they go out and get themselves a first aid kit for the home and the car as well.
Yeah, I find more people have them in the car.
Yeah, I think
you're
now
more likely to come across something traumatic in the car, and they're easy to buy as well in garages and things like that.
A lot of new cars come with them in the car.
Yeah.
Right. My next question is that how can one recognizes the sign of heart attack?
Okay.
And what should we do to assist that patient with a heart attack?
A heart attack. Would you like me to explain what a heart attack is first of all? So a heart attack is when you get a clot formed in the body and it settles in the heart, and what happens then, the blood flow can't go past where the clot is, and it starts to kill the muscle of the heart.
Of the heart, yeah. Okay.
And it's a serious life-threatening condition, this, a heart attack, and we treat it as one of our highest categories of cause. So the signs and symptoms vary very much between people, males, females, but generally the most common sign of a heart attack is central chest pain. People describe it differently, but a lot of people will describe it as a band around their chest, or the central crushing chest pain. A lot of people will say, it feels like someone sat on my chest, don't they? Yeah. But it feels tight.
ऐसे लोग करते हैं कि वो टाइट हो, ये जो चेस्ट में जो है ना टाइटनेस है.
Okay. The pain will go into their left arm, could be their right, often goes into their jaw and into their back as well. The patient may become very pale, grey, sweating. Okay. They'll feel sick, and they may say that they feel that they're short of breath as well, that they can't breathe. Okay. So there's a lot of symptoms. But chest pain is the most common one, and it is really important when someone has chest pain to call for an ambulance.
Right. So how can we assist that patient? Just to call an ambulance, or we can do something else?
Call for an ambulance. Don't give them anything to eat and drink.
All right, okay.
Sit them in the floor in what we call a W position. Someone who's having a heart attack will often collapse. So the best position for them to be in is sat comfortably on the floor. Okay, so then if they do collapse, they're on the floor and you can deal with them that way.
Right, okay. So my next question is quite similar to my first question, but it's about stroke. That how can one recognizes the sign of strokes and how we can assist that person who would like to
do stroke?
अच्छा, stroke फालिज जो होता है, हम ये अगर कोई किसी को फालिज हो रहा है ना, तो पहली बात ये है कि अगर वो बात कर रहे हैं ना, तो उनकी बात जो है ना वो मुरतब हो जाती है,
समझ नहीं आ रही है,
समझ नहीं, उनको फालिज जो होता है ना वो दिमाग में होता है, वो जो ब्लड सप्लाई जो होती है ना, दिमाग की ब्लड सप्लाई, उसमें कोई इंटरप्शन होती है, इसलिए फालिज होता है. अच्छा, तो पहली बात तो ये है कि अगर वो बात कर रहे हैं ना, तो उनकी बात में कोई समझ में नहीं आएगी. और दूसरी बात तो ये है कि वो जो उनके जो फेस जो है ना, उनका जो चेहरा जो होता है ना, एक साइड पे वो नीचे हो जाता है, उनकी आंखें भी नीचे हो जाती है, उनकी फेस जो उनके माउथ जो है ना, लिप्स जो होते हैं ना, वो भी नीचे हो जाते हैं। और दूसरी बात यह है कि उनके बाजू या उनके लत जो है ना, उसमें वो कमज़ोर हो जाता है, वो कमज़ोर, उसमें ताकत नहीं रहती। अगर आप ये साइंस जो है ना, अगर आप देखेंगे ना ये साइंस है, तो फिर फ़ौरन 999 टेलीफोन करना पड़ता है। ये बहुत इंपॉर्टेंट बात है कि वो फ़ौरन 999, अगर ये साइंस वो आप देखेंगे ना, फ़ौरन आप साइंस 999 टेलीफोन
That's
करो।
very
हाँ।
important. Right. How many emergencies in total you see a day? I mean, in a day, how many emergencies you can go for normally, normal routine?
A normal ambulance with 2 members of staff in normally go to about 10 to 12 jobs
Yeah.
a day.
Every day?
Yeah.
Every day, yes.
Yeah, it's very busy at the moment. We are, I think, across the whole of Northwest Ambulance Service, we are incredibly busy at the moment. Two reasons. एक पहली बात तो ये है कि this time of year, सर्दी का मौसम जो होता है ना, वो जो breathing difficulties जो होते हैं ना, वो ज़्यादा होते हैं। तो जिन लोगों को दमा होता है, आस्मा जो होता है ना, वो ज़्यादा तकलीफ़ होती है आस्मा से विंटर मंथ्स में। और दूसरी बात ये है कि वो जब बर्फ़ जब होती है बाहर, तो इट्स ईज़ी टू स्लिप। अब बंदे जो बाहर जाते हैं ना, वो स्लिप करते हैं ना, और वो जब फॉल होते हैं नीचे, तो उनको कोई इंजरी होती है। तो इसलिए I was just saying that we're quite busy because of the weather.
Yeah.
And the fact that people with asthma, breathing related difficulties, it gets worse over the winter months.
Yeah.
People with COPD generally become more unwell.
Right. Okay. We have to take a break and we will continue the discussion after break. So नाज़रीन, एक ब्रेक लेते हैं और ब्रेक के बाद आपके सामने फिर से हाजिर होते हैं। बहुत सी बातें करेंगे इनसे, बहुत से सवाल और भी जो पूछेंगे, और आप भी कॉल कर सकते हैं आफ्टर दिस शॉर्ट कमर्शियल ब्रेक। This program is brought to you by Community Reach Manchester in association with This program is brought to you by Community Reach Manchester in association with NHS North Manchester Clinical Commissioning Group. वेलकम बैक आफ्टर द ब्रेक। आज के प्रोग्राम में, हेल्थ आवर के इस प्रोग्राम में आपको ये बता रहे हैं कि जो फ़र्स्ट एड है उसको फ़र्स्ट एड कैसे प्रोवाइड की जा सकती है, और जो लाइफ थ्रेटनिंग कंडीशंस जब आती हैं जैसे कि स्ट्रोक है या हार्ट अटैक है, उसको आप घरों में कैसे डील कर सकते हैं। और खुदा न खास्ता किसी कोई बच्चा या बड़ा जो घर में कभी भी किसी को भी चोकिंग हो सकती है, उसके साथ कैसे डील करना है, उसका तो एक लाइव डेमो भी हमने आपको दिखाया पहले हिस्से में। अब ब्रेक के बाद हम आएँ तो जो टेलीफोन लाइंस हैं वो भी ओपन है, आप कॉल भी कर सकते हैं अगर आपको कोई सवाल है। इस हवाले से तो आप हमारे दोनों जो मेहमान हैं जुल्फ़िकार अली और सारा हैरिस यहाँ पर मौजूद हैं, आपको बता रहे हैं कि कैसे आप फ़र्स्ट एड दे सकते हैं घर में अगर कभी कोई वाक़या हो जाता है ऑफ़िस में। अब हम थोड़ा सा इनसे रिक्वेस्ट करेंगे कि लाइव डेमो दें हमें कि किस तरीके से किसी ये जो बेसिक स्किल्स हैं, हमें कौन सी बेसिक स्किल्स चाहिए कि अगर हमने किसी की जान बचानी है। So I think I would request both of you to show us a live demo on basic skills everyone should require. So Sara?
Yeah, the first skill we're going to show you is what to do if someone is unconscious but breathing. So it's going to be called the recovery position.
Okay.
Okay.
So for this, I've drawn the short straw.
Yeah.
So I've
Who's
got,
the volunteer?
I've got to be the dummy. Some would say I'm quite good at that.
So lie down.
Right. Just facing upwards.
Yeah.
Okay.
So say for example you came into the studio and you found this person collapsed on the floor.
Okay.
The first thing you would do is check for danger. So make sure that there's nothing putting you at danger, because if you're the first aider and you get injured, then nobody can help him.
Exactly.
So that's the first thing we always do, is check for danger. I can't see any obvious danger.
Okay.
The next thing I would do is check for response.
Okay.
So I would come down to the patient and I would go, hello, can you hear me? Open your eyes. Okay. To see if he might just be having a sleep, okay?
Yeah.
So, but he might be unwell.
Yep.
Okay, so that's what we do. Open your eyes, okay. At that point, if he doesn't respond to you, you would shout for help. So it would literally be help, just to try and get someone else's attention, because you might need help to move him, or you might need someone to phone the ambulance
That's
for
right.
you. Okay. So the next thing we would do is A for airway. We call this doctor's ABC to remember it. So it's as easy as you're learning your alphabet.
True.
So the first thing we do is open the airway. So we do this. We do a head tilt chin lift. So we put our hand on here and we lift up like so. And what that does is it takes off the tongue off the airway. We don't swallow the tongue. People, you hear that, they swallowed the tongue. Your tongue is a large muscle that when you go unconscious becomes relaxed. So by doing that, it lifts that tongue off the back of the airway.
Okay.
And sometimes that might be enough for them to take a breath.
True.
Okay, so we've done this, and then we're going to look, listen and feel for breathing for up to 10 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so he's breathing, okay, but he's unconscious. I don't know why he's unconscious, so I would now call an ambulance, or if you're my help, I would ask you to go and call for an ambulance.
Okay.
He's not in a safe position being on his back, so therefore I'm going to put him in the recovery position. So I would straighten his legs, like so. The first thing we would do is we bring this hand up here, okay, and we bring this second hand across like so. All right. We then pick up his leg, and as a lever, we pull him across like so. We bring this leg here, and this head would come up like so.
Okay.
So that's in a really safe position now. So if he's sick, he won't choke on his
He won't choke. All right.
I can monitor him, and then if I think he's stopped breathing, I can push him back onto his back to then demonstrate what I'm going to demonstrate next is the CPR.
Okay.
So that's an unconscious breathing patient
Okay.
you would put in the recovery position.
That's fine.
And children can do this, you know, because you're using the body and we teach children as young as 6 to learn and how to do the recovery position.
Really good. Yeah. So now next stage is the CPR then.
Okay. So we're going to use the dummy this time.
Do I have to get up now?
Yeah, please.
Thank you, Zulfiqar. You've done a good job.
You're welcome. That was well easy. I could do that again.
So if you pass us an AED. So
just get rid of that.
this time the patient is not breathing. Okay.
So what is CPR?
It stands for cardiopulmonary resuscitation.
Cardiopulmonary resuscitation.
Okay.
Right. I just want to shout for the callers. अगर आप कॉल करना चाहते हैं, कुछ पूछना चाहते हैं, तो प्लीज़ ज़रूर कॉल करें और आपको अगर कोई सवाल आपने पूछना है तो आप दोनों से पूछ सकते हैं और मैं आपकी हेल्प करूँगी आपका सवाल इन तक पहुँचाने में और जवाब तक पहुँचाने में. जी.
Okay. Okay. So you've come into the studio again,
Okay.
and when we train this to people, we teach it them the same over and over again so they remember it.
Okay.
So the first thing we do is check for danger. There's no danger. The next thing we would do, we'd come down. Hello, can you hear me? Can you open your eyes? Help! Okay, so that's what we would do. So hopefully someone would come and help us. We then open the airway and we look, listen and feel for normal breathing for 10 seconds. So when we've done 10 seconds, on this occasion, he's not breathing. Okay?
All right. Okay.
So we're going to call for an ambulance.
Okay.
It's really important at this stage we call for an ambulance because this is our highest category of call now. This patient is not breathing and we have only got about 4 minutes to make a difference now. It's really important. This is time critical. So what we need to do is start CPR straight away.
Okay.
Okay, so we're going to come across over the body. We need to get the person flat on the floor. Okay. Now 80% of cardiac arrests occur in the home, so the chances are it will be maybe a viewer's relative that they find collapsed at home.
Okay.
So this is why it's so important to learn this skill now.
Sorry, do you want me to do CPR? And you can,
If I
go
stop.
through it?
Yes. Okay. So do you want to? So, what would happen? He would put his hands in the centre of the chest. Yes, please.
Middle me.
Okay. He'd lean over the body and he'd press down 30 times.
Yes.
Okay.
All right. One. Oh.
And he would be doing 2 a second. So he's aiming for 110.
S is speed B.
When a patient is not breathing.
When they're not breathing. Okay. So this is called a cardiac arrest.
All right.
It means the heart has gone into an abnormal rhythm and you need to do the job of the heart, which is a pump. So by doing this, you're pumping blood around the body. So you would do this 30 times, okay? After 30 times, he would give 2 breaths. So head tilt, so we'd tilt the head back. That's it, and do the breath.
Open the mouth.
And he'd give a breath, and then he'd give another breath. And then he'd go straight back into CPR. So it's about 110 times a minute.
Okay.
About a third of the depth of the chest, or 5 to 6
All
centimetres in an adult.
Okay.
And you would carry on this going now until the ambulance got there. Essentially what you're doing is keeping this person alive.
Alive, right, okay, yeah, because that was, I was going to ask you that if it's only 4 minutes can make a difference and ambulance could take much longer than that.
Yes.
What should we do? So this is the thing which we will be doing while waiting for the ambulance.
Yes, and you don't stop.
Yeah.
Okay. The next thing we can do is use a defibrillator. So this is the defibrillator. Okay. And this gives the heart a controlled electric shock.
Okay.
Okay. Now you wouldn't necessarily have these in the home.
At home, yeah.
But there might be one in a business or a shopping centre.
Okay.
So you've got to imagine now that CPR is going on. It's not stopped. Okay.
Okay.
So we would open the defib, and it talks to us. Could you just pass me the remote, please?
Call for help now.
So,
it
Remove all clothing from patient's
so
chest.
you would cut the clothes off the patient. Okay. You listen to the machine. It talks to you. It tells you to pull out the handle.
Pull red handle to open bag.
The aim of these machines is that for someone maybe like you,
Exactly.
who's never
Look at
used them,
pictures
Exactly.
on pad.
and it will talk you all the way through.
Peel one pad off blue
So you
plastic.
peel the pad.
Okay.
So
Apply pad
the
to
chest
bare
is now
skin,
bare.
exactly as shown
You may
in
have
the
had to
picture.
shave the chest. So
Press
there's a
pad
they come
firmly.
with a razor.
All right, so
They come with
okay.
scissors.
Peel other
They
pad
come with everything
off
you
blue
need.
plastic.
All right.
You would put one there.
Apply pad to bare skin. exactly as
and
shown
you would
in the
put one
picture.
there.
Press pad firmly. Do not
As
touch
soon as those
patient.
pads are on the patient, the machine
Evaluating heart
recognises it,
rhythm.
and he's doing a quick ECG to see if the patient needs a shock.
Stand by. Preparing to shock.
So the machine will then charge up,
Everyone clear.
There'll be a
Press
light on the
flashing
machine.
button.
and we would press the light.
Shock
As
delivered.
soon as we've given that
Provide
shock,
chest compressions and rescue
we come
breath.
back in to do CPR, and we do CPR for 2 minutes, and we shock every 2 minutes. The machine counts the 2 minutes down for you. After 2 minutes, it will say, after 2 minutes, it will say,
Continue care.
shock, analysing rhythm, and will tell you whether you need to shock the patient. The machine does not charge up unless the person is in cardiac arrest or needs a shock. So you can't, as a lay responder, you can't go wrong because the
Continue
machine
care.
Is there to assist you?
is there to assist you.
So that's very important to keep at homes, or not at homes, then at least in the offices.
In businesses, we should
Businesses.
have them in all businesses, in public places, in schools. North West Ambulance Service have recently gone to Parliament and
Continue
spoke.
care.
I'll turn it off now. We've recently gone to the House of Commons, and we spoke there to try and make it that every school and every public place
Should
has
have this
one,
machine,
and that
yeah.
every child is taught this, because these are life-saving skills that children can use, that then go home and teach their parents.
Okay.
And it's often the children who have to use those life-saving
Sure.
skills.
So what is their response then?
We're working on it.
Still working.
The Department of Education have produced a guide, and a lot of the MPs are very interested in the work, and we're just working
Because
with
that
them.
is really important. You can save lives.
Yes.
Because like as you said, as a normal lay person, I don't think so we'll be able to cope at home. I mean, you need a proper training to deal with the patient with the cardiac arrest. It's really hard to do that, because sometimes if something happens with your husband or a wife, obviously the next of kin will be confused.
Yeah.
I mean, he won't be able to deal with it
Yeah.
because he's in a state of shock himself.
Yeah.
So this is really important to get trained, but unfortunately I don't think so.
No, and a lot
Nobody
of
is-
people learn how to do CPR on the phone, because we have really trained call handlers who are trained to give you CPR advice over the phone. But can you imagine your relative is on the floor and you're holding the phone and you're trying to learn CPR, learn it before the event.
Right. Can you advise about any child who become unconscious
Okay,
or stopped
it's
breathing?
exactly the same as what
Same
we've just
thing,
shown
okay.
you, okay? But with a child between the age of 1 and puberty, we would use one hand. So we would use one hand like that.
Okay.
Because you don't need as much force on the child. If it
Okay.
was a baby, like we showed you with the choking before, we use 2 fingers.
2 fingers, yes.
And it is the same.
All right. Same with the chest. You only use two fingers to.
The only difference with a child and a baby, we would give them 5 breaths first. Okay. We can use a defibrillator on children if we needed to. Some will have pads in that are specifically for children, and some otherwise we would put the pads on the front and the back.
Right. Okay. That's very good. Thank you very much, Sara. I think you can go back to your seat and we
Okay.
can talk about this in detail. Obviously, I think we have few minutes left. But Zulfiqar, हम जो स्पेशली अगर हम एशियन कम्युनिटी की बात करते हैं, हम लोग क्या आपने देखा इन योर एक्सपीरियंस, हम रेडी होते हैं ऐसे शॉक को हैंडल करने के लिए?
Unfortunately नहीं. बात यह है कि like you explained, ये जो situations जो है ना, बहुत stressful situation है, और सिर्फ हमारी community में नहीं, all communities, ये जो situation है बहुत stressful situation है. इसलिए सारा जो है ना comes on shows like this, हम मकसद ये है कि हम teach करते हैं as many people as possible कि CPR कैसे करना है, और how easy, ये जो machine जो है ना कितनी simple ये machine है, ये machine तो सब कुछ काम
It's
तो
a
machine करती है.
life-saving.
Indeed, ये
life-saving
machine सब काम तो machine करती है. All we have to do is put ये जो panels जो stickers जो है ना, stickers chest पे लगाने, और ये picture भी लगी हुई है कि chest पे कहाँ ये
कहाँ
लगते
लगाना
हैं. ये it's simple as that. लेकिन हमारे जो communities है ना, क्योंकि youngsters जो है ना, वो जो नई इक्विपमेंट, ऐसी इक्विपमेंट जो है ना, वो नई इक्विपमेंट देख के वो उनको कोई फिक्र नहीं होता। ये जो लेकिन जो हमारी कम्युनिटी में ज़रा उम्र वाले हैं ना,
हाँ
वो देखते हैं और वो कहते हैं कि ये हमको समझ नहीं लगेगी कि ये कहाँ रखना है। अगर हम इसको इनकरेक्ट हम इस्तेमाल करेंगे तो क्या पता कि वो जो बीमार हो वो ज़्यादा बीमार हो जाएगा। ज़रा फियर जो होता है ना, ओल्ड कम्युनिटीज़ में फियर होता है। ये तो होता है, ये तो बात सच्ची है। लेकिन हमारी जो कम्युनिटीज़ है ना, हम इंशाल्लाह हम अभी ये काम कर रहे हैं आपके साथ। नेक्स्ट हमको पता नहीं, हमको शायद फंडिंग मिल जाएगी तो हम मस्जिद में हम ये रख सकते हैं। लेकिन इम्पोर्टेंट बात ये है कि स्कूल लीवर्स जो है ना, ये सब स्कूल लीवर्स जो है, हमको उन सबको इंशाल्लाह पता हो जाएगा फर्स्ट एड करने का। वो स्कूल्स में टीच करेंगे और वो सब फर्स्ट एड उनको पता होगा फर्स्ट एड कैसे करते हैं। तो फिर इंशाल्लाह थोड़ा कम्युनिटीज़ में भी पता लग जाएगा।
Right, Sarah, on the basis of your experience, any advice you want to give it to viewers, especially when it comes to first aid?
Is make sure you learn it before the event. And if today you've watched this programme and you think, I really don't know what to do, then find a course locally and learn how to do CPR. I'm really passionate about CPR and defibrillators, and as a parent, both my children's schools have got defibrillators in their schools, and I would urge people, if they've got children within school, go into the school and say, are we teaching our children this skill, and do we have a defibrillator? But learn these skills before you actually need to use them.
Right, but are we, especially as you mentioned in schools, there is some time, because I've heard from my children, I've learned from them as well, that there was a first training in the school, and they were just teaching us what to do in the case of any emergencies. But generally, do you think that will increase, or we will be able to live a little bit longer because of all this awareness and
Definitely.
these machines and everything?
In the UK, our survival rates from cardiac arrest are really poor, about 1 in 10. In other European countries, their survival rates are 1 in 4. Okay, and the reason for that is, one, they have a lot more defibrillators in public places, and two, is that they teach all their school children CPR. Okay, they normalise the skill so that they learn it in school, then they go to work, they learn it in work. And in other European countries, they have a much higher uptake of people actually doing CPR on somebody.
Right. When you go to attend emergencies at home, any home, do the family, do they cooperate with you, or do you have any incident that you want to mention, or you want to tell people, look, when we are there to help you, please cooperate with us?
They don't always cooperate. Sometimes people can be quite aggressive to us. They might perceive that we're not doing stuff, or we're not doing something quick enough, and might be aggressive towards us. This isn't everybody, but what we need is we need to be able to get to the patient, to get to them quickly, to have their medical history, their tablets, and you know, we might need help to move furniture to get the patient out of the house into the ambulance. We just need cooperation and
well, I think if patients are really ill, wo jo mareez zyada bimar ho, if they're really ill, then you get a lot of cooperation, because people understand that they need to be assisted as quick as possible to get to hospital. But sometimes if things aren't that necessarily clear cut, sometimes, for example, if we go to say somewhere where there's a party, for example, a party go, and then sometimes it's a bit hard to make everybody understand that it's an emergency and we need to get through quickly, and we need to assess the patients quickly. But on the whole, I think certainly within my experiences, most people's houses that we go to, they're generally very welcoming, very welcoming,
and will listen to us and get us the information that we need.
आम तौर से हमारे लोग जो हैं वो पहली बात वो पूछते हैं कि अली आपने चाय पीनी है, हम बोलते हैं कि नहीं चाय पीनी है,
इमरजेंसी को डील करना है,
इमरजेंसी पहले डील करेंगे तो बाद में इंशाल्लाह चाय पीएंगे.
अच्छा, कभी आपको ऐसा फील होता है कि लोग इन्होंने हमें 999 डायल किया, एम्बुलेंस इज हियर, बट दे डोंट really need an ambulance to attend, that was a very minor cause. How do you feel, and if you try to explain it to them, how do they feel that you don't need to go to emergency, you're fine, it was a very minor injury or minor ailment, you could have waited till tomorrow and go to your GP? when this happens, how the family feel? I mean,
Uh,
are you in trouble then?
No, मेरे experience में ये जो educational चीज़ है, ये educational बात है. It's important that we educate the public to understand that not all emergencies require hospitalization. वो जो minor injuries जो है ना, वो अस्पताल ले जाने के लिए ज़रूरत नहीं. वो walk-in centers जा सकते हैं या वो जो
GP के पास जा सकते हैं, pharmacy में जा सकते हैं.
pharmacies भी अभी तो माशाल्लाह pharmacies लेट नाइट 12 बजे तक खुले रहते हैं. वो फार्मेसी के भी पास जा सकते हैं. लेकिन on the whole, most people, if you try and explain that A&E is not for them, most people like understand that. अभी तो बहुत सारी मीडिया में बहुत सारे प्रोग्राम्स लगे हुए हैं जो वो कहते हैं कि A&E सर्विस जो है वो फुल कैपेसिटी पे है. वो A&E सर्विसेज जो है ना, अगर वो आप वहाँ जाएंगे तो मिनिमम आपके 4 आवर वेट करना पड़ेगा.
yes.
वो तो अभी मीडिया के तरफ से many more people are aware. बहुत सारे
वैसे कोई फर्क पड़ा इस
थोड़ा सा फर्क हुआ. Do you find there was any difference with the media, after the media coverage, that people understood that A&E wasn't for everybody?
Yeah, and our trust has spent a lot of time recently with a campaign called Team 999, trying to explain to people that every time you phone 999, you might not get an ambulance.
Yeah.
You might get advice over the telephone.
Right.
We have specialist paramedics and nurses on the phone, giving people advice over the phone, and clinical pathways that our paramedics and other ambulance staff can
so
go
that's
down.
That's a good news, that if people are getting this information and there's a less burden on A&E, so that's a good news. Anyway, thank you very much Zulfiqar, thank you very much.
It was a pleasure. Thank you for having us
Urdu
on
bhi
your
हमारे
show.
लिए बहुत helpful
थोड़ी
थी. So
कोशिश
nice of you.
तो किया.
That's how you learn Urdu as well now. Thank you. Thank you, Sara. Thank you very much for this lovely demonstration. And I think it was really important for us, for all of us to know what we should do. Don't panic, but try to help the patient.
Yes.
Thank you very much for all this.
Thank you.
जी नाज़रीन, ये था आज का प्रोग्राम. इसी प्रोग्राम के साथ दोबारा आपसे मुलाकात होगी नेक्स्ट वीक, लेकिन वीक के दौरान तो मुख्तलिफ प्रोग्राम्स होंगे और आपसे मुलाकात होगी. फ़िलहाल आपसे इजाज़त चाहूँगी. अल्लाह हाफ़िज़. दिस प्रोग्राम इज़ ब्रॉट टू यू बाय कम्युनिटी रीच मैनचेस्टर in association with NHS North Manchester Clinical Commissioning Group.